Ready? Ready? Ready?
Ready.
Hey guys, it's Dr. Emer. We're in West Hollywood and it's staff treatment night. I know you all look forward to this almost every quarter. And we have Brittany in the hot seat today, and she's never had treatments done, at least by me, and I don't think she's ever had anything done before. So with that said, we're going to do what I call the female facial sculpting, female enhancement. We're not going to do anything aggressive, but there's certain things that certain young women like. They like to keep their brows elevated so they don't have eyelids that are hooded. They like to have nice plump lips, and they like softening kind of around the mouth and chin. So we're just going to do some softening. She already has a nice full cheek. She has a beautiful jawline, beautiful eyes. So let's take the focus onto her eyes and let's enhance those features. So we're going to lift the brow and soften around the mouth. So we're going to first use Juvederm Ultra Plus. And this is great because it has a lot of substance. This will allow me to give her some lift in the brow. First injection, literally 1 point, nothing too bad. We go right down to a very safe area in the bone. We inject some of the filler. And I always tell people this feels a little strange in this area sometimes because you can hear it. It almost feels like it's going into the brain, but it's not. It's on the bone, called periosteum. It's right there in a very safe area. I actually have my finger over the vein. I can feel it pulsing. I know she's nervous, but I know she's going to do well. So we press down and we literally reposition. We're going right into the brow. We're giving brow temple region. We're just giving a nice amount of filler there. And that's going to give her some substance and some lift.
How long will this last?
These will typically last 9 to 12 months. Now I'm going to do about close to half the syringe, because now I'm going to move right above the brow, right into the area. This is a little spicy sometimes, just a slight little bit. You can see it rise. You see right there, starting to rise just a small bit. We're going to hold it right at the edge there, and then we're going to massage it right down. Let me show you. This region here allows us to do a nice little depot to get the lift, and then we push that right onto the bone so we can see an instant lift. She's going to be swollen there for just a short time period, but you're going to see already an elevation from one side to the other. How is that pain level? Not too bad. See, she's a tough cookie. So we're going to go directly again down to the bone, right into that temple region, giving a little support. Honestly, this is one of my favorite things to do for women because traditionally they don't think to do this, and it gives such a wow factor over the next few months that they get really happy. Exactly. Any questions so far?
Could you repeat what you're doing for everyone just tuning in?
Yeah, we're doing right now female facial sculpting. We're using filler to elevate the brow and fill out the temple. We're going to go right into a very safe area, directly onto the bone, and just give a little bit of an injection there. And soften and lift. And you can see an instant elevation from just supporting the periosteum there. Now we're going to go to her lip. And we're going to use Juvederm Velour because I like that it gives a little of substance. She wants some substance. She doesn't feel like she has a big lip, or a big upper lip at least, but it's also soft at the same time. And for her, she has a very small cupid's bow, so we're going to go real slow. Just do little threads. This is a very soft filler and gives a lot of definition. When placed in micro aliquots, it looks really nice, really, really nice. We can define her columns and give her a little lift there. And we can soften all parts of the lip, doing very subtle injection in very little bits. And give her a little break. Now I also like to do a little into the corner, just a little support, kind of upturn the corner slightly. Okay, that will give her a nice support. You can already see half the lip done. Take a look. Half of her lip already softer and very nice. And we're going to keep going, just very little. Micro aliquots. Just that subtle bit.
Can you use Radius in the lips?
You can't. Radius is a calcium-based filler that's very hard. Little pinches. And in my opinion, it shouldn't be used in that area.
Do you aspirate in the temples?
I do not, because we're in a safe plane. That plane has no blood vessels. But I'm an expert injector, and I'm not saying that you can't, I just don't need to. So now we're also going to define the Cupid's bow on this side. Perfect. I'm going to give her a little more volume. I'm feeling a little more voluminous lip for her. What do you think?
Comment down below. Let us know.
Comment below. Do you think Britt should be more voluminous? Let's do it.
Everyone's saying she's so pretty.
She
is pretty. Did
Those
she
look
numb
so
before
good.
this?
She numbed, but lips always hurt. No pain, no gain.
Do you think the lips are the most sensitive area when doing filler?
Probably. I would say so. You know, let me take a look. I still want to go a little more.
Everyone's saying pouty bottom lip.
So now, let's balance it out. Okay. Now let's wipe that down. And then we're going to just do a little inner folds. I'm going to have my PA, Danielle, work with me to finish this up. Hold on. Oh, these are amazing. Look at that. Look at that lip, you guys. I can't wait till she sees that. So that's a really soft look. So Danielle's now going to do some injections on the fold. And here's the thing. We want to do a little bit of injection up here because look what happens when I press here. It everts the lip. So just start by doing a small injection into the top of the nasolabial fold at the corner. And we're just going to go deep breath, deep breath. Good. Just going to go just a little aliquot there, a little thread. Give a little bit there, and it's just going to follow down into the fold just a small bit. Very good. One more. This is going to give support to the entire mouth area. Now, one area I think needs support as people age is right here, because this caves in and it allows the mouth to droop. So a little bit through here and a little bit through here gives support to the lip corner. So we're going to do a little bit in that area to do what I call dimensional contouring, to give support to her chin and around her mouth. Great. So now we're going to go to the other side. She's doing great. She's almost done. Again, we're going to give support to the nasolabial fold right at that junction by the nose so we can get a nice support, nice eversion to the lip, a little bit to the fold to just soften everything. And then again, support here in the marionette area, what we call the lower cutaneous lip, to give support or dimensional contouring to the chin. Perfect. Now, since we have a little left, let's just do a little dab in right here in the chin to just support everything because it's going to make her lips look amazing. Perfect. Go right down to bone. Give just a little bit. One more. And this is going to bring together. Very good. Everything we just did. Good. I'm going to do that other one over here if you're going to do that.
Is velour like Volbella?
Yeah, so there's Volbella, Velour, and Voluma that are all Vicross. And Voluma being the most structured, Velour being the least, and Velour in between. So let's show her, you guys. Let's show her what we just did. Because this is what I call feature enhancement. She did great. And I'll wipe off those tears. But she'll be tears of joy when I show you this.
No tears.
All right, let's wipe her. Let's actually wipe a little more. Let's get the blood streaks off of there.
Sorry, let me.
All right, show her the final product. Okay. Let's see. What is everyone thinking on
Drum roll,
online?
Let us know.
I'm gonna take that.
So natural.
What do you think?
It's beautiful. Super excited.
Tell us about what you were expecting.
Give it a little upturn.
Everyone's saying beautiful.
Yeah, no, this is like beyond my expectations. This is amazing.
What do you love about it?
Just love the definition and fullness. And everything's so subtle. Doesn't even look like I got anything done.
What do you think about the chin
Satisfying.
projection? And the brow. Look at that brow lift.
Beyond my expectations. I love it.
Great.
It's so good.
And it's still your shape, just a little bit bigger like you want
So
it.
this is what we want, subtle improvement. Now to further enhance the brow lift, and you can see it's already arched, it looks great. We're now going to do a Botox brow lift, or what we call chemical brow lift. And to do that, you squeeze in, show everyone those 11s, get mad. Now relax. Squeeze in again. Okay, relax. We're going to go directly into the muscle here. We're going to inject just a little bit. I do my little tapping. Jacked again, just a little bit. One more, right into those muscles that she was activating when she had that scowl. We're going to squeeze in again. Perfect. And then we're going to use that little extra bit right at the edge of the eye, of the superior portion of the auricularis, and get a nice lift to the brow. And in about 2 weeks, she's going to look fantastic. So that's female facial sculpting, you guys, with the mouth, the chin.